All right, this isn't just a conversation. This is a meeting between two operators who believe healthcare market must be rebuilt from the ground up. On the show today, I'm super excited to have Lucien Morin, founder of Savvos Health, Savvos. I love it. A company that you're going to want to remember. They're not trying to digitize the existing system. They're trying to replace it with something better. I learned that last week when I visited you guys. It's a transparent physician access marketplace where prices are known, quality is measurable, and patients can finally act like customers, as can employers. Now, this is based on we've known each other a year. And I was like, well, Lucian's not just a tech founder, he's a systems thinker. I think that's what I thought when we were on our way to the airport. Savvos is building the infrastructure to connect employers, physicians, patients, without the middleman markup and the rest of the grift. If you've ever asked yourself, what must US healthcare look like? I think this next 30 minutes is just for you. We're going to talk transparency, direct contracting, employer strategy, maybe even AI in healthcare transactions, and the mindset required to build healthcare without getting swallowed. All right, so hold on, my dear friends, because I think this is going to be a great conversation. I really like Lucien. Oh, I like his kids too, because they all work at the Savvos, and so I like the whole team. Anyways, man, what's going on? How are you?
I'm great, and your intro stole like every good talking point I had, so this might end up being like 5 minutes. So.
Yeah, we're done. I think you had so many good things to say. We were on the way to the airport. I was like writing stuff down, and then I transcribed it when I got to the airport. So the first thing I want to ask is, why does direct contracting fail? And why does Savvos continue to do better than everyone else?
Well, I think that's a great question. When I look at what's happening in the market today, and certainly like customer sentiment is moving, like the winds of change are pushing us all in the right direction. I think everybody wants to transact a little bit better. I think everybody wants to do differently here in this space. When I look at like, why have we struggled? Why are we having issues getting some of these principles off the ground? I think we need to shift the conversation just a little bit. I think about where we're at. I think about the noise right now, and we hear a lot about transparency in the data, but at Savvos, we look at the industry a little bit different. I think the focus needs to be on transparency in the transaction. Like you see a lot of great solutions that are hitting the market, but the problem is we're building everything around this outdated, inefficient business model. Like healthcare, like the whole business of healthcare is built around probably the worst business model that was ever invented. This idea of claims processing in the hands of some third-party entity. And so the challenge that I feel like we're having in the space right now is there's a lot of great ideas, but we're building it on a very dysfunctional system. We're optimizing dysfunction. And that's not the way to solve a lot of the problems in healthcare today. Like you said in some of your initial comments, we need to look at ways to rebuild this from the ground up. People want to transact differently. So when you talk about free market solutions, when you talk about making direct contracting, direct pay relationships, mainstream, I mean, that's really the movement of Savvos. I mean, not only have we grown to be the nation's largest cash pay marketplace, I always hesitate to use that term, but the real focus of Savvos is to create a very modern business transaction in the healthcare space, to make claims processing a thing of the past. So our tech sits right in the middle there. Like we have created this digital bridge between the demand side, health plans and their members, and the supply side providers, whether it's surgery centers, physician-owned hospitals, or whatever that might be. We create these direct connections and we completely replace that outdated model. So I think you're going to see that whole idea of replacing this outdated business transaction really just kind of come.
Like, why do people think we have to fix the existing system? Like, you and I have spent a bunch of time talking recently, and what I loved about the solution was like, we don't even need insurance companies. We don't need the carrier to be the ASO anymore. We can just connect the employer with everybody that they want. Why are you getting pushback on that, or are you seeing success?
Well, I think for me, when I look at what's happening in the space today, like direct pay relationships, free market, I mean, that's an easy transaction in a self-pay environment. But when you touch about revolutionizing the business of healthcare in a third-party payer environment, you've got to look at where it's broken. And certainly when you look at the data, there's some real problems in healthcare. Like look back about a year ago, in the United States, we spent about $5 trillion on healthcare in 2023. And
That's insane.
it's insane, but only about $1 trillion actually went to front end clinicians, your physicians, your surgeons, your nurses, everybody else. So you talk about why do we need to rebuild the way we transact in business? The business of healthcare is built around a bloated, inefficient, I would dare to say, criminal enterprise. I mean, we're spending almost 80% of every dollar we spend on healthcare on expenses other than front-end clinicians. There's a problem in the system, right? So it's not about optimizing dysfunction in an existing market. We have to look at ways to transact differently. And that's really what Savvos is doing.
So where did this genesis come from? Because I remember when I met you guys a couple years ago or a year and a half ago or so, I remember seeing your portal and thinking, holy smokes. I was working with a small hospital system. That's how you and I met in Texas. And they were trying to maybe go to Arizona. We were trying to help them do some direct contracting. And I remember just seeing your platform and how easy it was to use. What was the genesis of that? Because you did some work before in healthcare and then you shifted out. Where did this crazy kind of idea come from? You're like, oh, well, let's just build a free market solution and let's just, fix all $4 trillion of the problems in healthcare. I think that's a pretty remarkable thought.
Well, it certainly has matured over the years. Like I look back over the last 20, 30, 40 years, and it seems like about every decade we try to reinvent ourselves in healthcare, right? Whether it's from a product
Yes.
standpoint or from a regulatory standpoint, we're always trying to find a way to fix what's happening in healthcare. I think the value of a private market comes with the risk of all this abuse and inefficiencies if we're not careful. And the reality is, I feel like over the last 20 years, what we've seen is I feel like we've seen legislation lead out in terms of trying to solve some of the problems in healthcare. And I think what people have learned really fast is effective legislation never leads. It always follows a consumer movement, right? Like we've got to engage consumers. We've got to build solutions and then we can let legislation follow. And what I watched is, particularly since March 23rd of 2010, when the Affordable Care Act went into effect, as more and more provisions of the ACA went live, particularly January 1 of 2014, you could start to feel almost immediately the unintended consequences of federal regulations in healthcare, right? So initially, when we founded Savvos, the initial response was, well, let's make it easier to connect from an affordability standpoint. So originally, Savvos was built around transparent marketplaces and accessing good data. But what we learned pretty fast was a real marketplace is not data, it's engagement. We need the ability, and particularly when you're talking about affordability in a third-party payer environment, we need the ability to bring these stakeholders together. I mean, if I'm a self-pay individual and somebody tells me that I can get my meniscus repaired for $2,000 at a local facility, it's a pretty easy transaction for me to put together. But if I all of a sudden pull into the mix of third-party payer, a health plan, or my self-funded employer's plan or whatnot, trying to put that transaction together is very difficult. So that's kind of where the genesis of Savvos, it's matured over the years. Like we've learned step by step that we need to move beyond data and we need to create stakeholder engagement. And that's really the value of Savvos. We build these direct digital connections between the major stakeholders in a healthcare transaction, between the health plan, between the member, between the providers, right? So we might plug in a surgery center, we might plug in their physician, and we just create engagement, the ability to have a simple, single point of conversation to determine exactly what care needs to be delivered, to finalize the exact price for that care, to approve it, and then ultimately just to ensure that providers are paid immediately. I mean, experience is key in today's market, but Dutch, it's interesting from an affordability standpoint, we see so many strategies in the market today, but most of them only benefit maybe one or two stakeholders. Like maybe it's better for the health plan, maybe it's better for the member. Oftentimes, what we put on the sacrificial altar is the provider, right? Like we're going to beat up that provider in order to make healthcare more affordable. Well, Savvos approaches the market very, very different. We go to these providers. Let's say, Dutch, you've got a surgery center in Illinois. We'll come to you and say, Dutch, we've got all kinds of members in the area plugged into Savvos. We'll drive them to you. And as soon as you deliver care, we ensure that you're paid immediately. So there's no complex billing. There's no complex HCFAs or 837 file feeds. There's no revenue cycle management, waiting 14 months to collect your money. I mean, we simplify the transaction for providers.
And you guys pay in, like, I turn in my invoice and you pay me. That's how it works?
Yeah, in fact, there's really, within the Savvos platform, there's really no paperwork for providers whatsoever. So our tech not only brings all these stakeholders together in a simple conversation, but providers can custom build pricing in real time. I mean, they'll do it right before your eyes. So they're looking at a physician order and they're like, I got a meniscus repair. Looks like I've got a torn ACL. Let me just customize my price. They'll lock it down in a matter of minutes, right in front of the health plan rep, right in front of the employee. So what it gives us is tremendous flexibility for providers to build a price specific for that member. The health plan approves that price. But here's the secret sauce, Dutch. If you want to solve for the problems in healthcare, create a better experience for providers. Don't hold providers hostage. But if you can simplify the transaction and guarantee immediate payment, Dutch, providers will roll out the red carpet for you.
For sure.
Yeah, that's what we see in the market, right? So we go to providers and we say, listen, like, you'll have no revenue cycle management. You're not going to be trying to collect for the next 14 months. Like, I'll give you an example. We have a spine surgery center in the Midwest we work with. And I was on the phone with one of the owners, a surgeon. Oh, this was probably about a year ago. And he said, Lou, I got over $1 million of receivables. I've been trying to collect them for over a year. I got a whole team of people that spend 1 day a week doing approvals, pre-auths, denials, appeals. He's like, I spend almost 30% of every dollar I build just desperately trying to collect my money. So if you can walk into one of these issues, and the reality is it's not just these independent facilities, right?
Yep.
You look at in the West here, I actually had lunch about 6 weeks ago with some of the executives at one of the larger hospital systems here in the Western states. And so here we're talking about one of the biggest players in healthcare out here. And their comment was, we're getting killed. We're writing off hundreds of millions of bad debt every year. Our revenue cycle management is just crushing us. We just want to collect our money. Isn't that interesting? So this is trickling all the way up to some of the biggest players, where now we're at a point in the industry where all of the stakeholders, and especially on the supply side, they just want a better transaction.
Do you think, you have been in direct contracting a very long time now, do you see health systems moving more towards a Savvos type model?
Yeah, I mean, it depends on the health system, right? I mean, some of them are built around just blatant, terrible billing. I mean, I'm not saying that very well, but there's a lot of health systems in a few markets that we work in. I mean, their business model is basically just to take as much as they can for as long as they can. And we've seen them, but I've also seen even larger health systems, hospital systems. There's a lot of great players that are looking for a better way to transact. Like, they want to.
Yeah, I think I'm thinking about the 700 or 800 out of the 10,000 more community hospitals. And I introduced you to a couple of smaller hospitals. I'm wondering if you're seeing more of them, right? So let's say Intermountain Healthcare is at the top. Those are the biggest systems in the country. And then let's work our way down. Do you see maybe the middle markets of the health systems or smaller hospitals saying Medicare doesn't pay as much? The commercial guys are okay, but they love the big health systems. Is there a place where you're able to walk in, and are you starting to see the traction on that?
Well, absolutely. And that's what's really exciting about when you look at Savvos Connect and our platform. There's tremendous interest, to your point, like at kind of this middle level of these physician-owned hospitals or these community hospital systems or whatnot, where oftentimes, like, you look at what's happening with some of these bigger networks in their local market, they're steering everybody to these larger hospital systems. Networks 30 years ago were a cost containment tool. Now they're nothing more than a profit center for a lot of these stakeholders.
That's right.
And what you're seeing with these hospital systems, these physician-owned hospitals, these community hospitals, in addition to these ambulatory surgical centers, imaging centers, they want to build more direct pay relationships with the community. They want to move away from these legacy networks and these complex billing practices. And as we have these conversations, what we've learned is, yeah, they want to do it, but they realize that it's not as easy as they thought. Like taking their solutions and going to an employer with 1,000 lives and trying to steer business out of the network and build direct pay relationships, it requires a little bit of sophistication, right? Like you've got to amend their plan document. You've got to build payment rails. You've got to streamline communication. And really that's where Savvos is having so much success now, because we not only layer in our technology into health plans, but we're now working with providers across the country, these exact hospitals that you're talking about. And we're saying, look, why don't you just license our tech and we'll help you go build direct pay relationships in your local community. And that is receiving a tremendous.
This is the part I like the most. When you told me that, I think I got on fire. My soul was like, this is where I think the business is going. Tell me, how do you do that? And what made you think about saying, we love helping employers. We love talking to brokers and consultants. I know you have great relationships with that community, but you added something, and I think it's pretty special. And you said, we know some physician-owned hospitals, we know surgery centers, we know middle market health systems. We really can kind of put this in a product for them. And we can help them with all the challenges they're facing. Because I'm sure they come to you and they go, Lucien, we tried this on our own. I've heard that 10,000 times. We tried it on our own. It just didn't work, Doug. And then I heard your solution and I'm going, well, no, this is what you need. If you have your own back end, you win because you'll do it all for them. Is that what I'm hearing?
Oh, yeah. Gosh, we could talk for the next hour just on this topic. Like currently, there's a tremendous amount of support from Savvos, from our provider outreach team, our member support team. But ultimately, our technology is meant to be more of a SaaS product where like we can kind of plug and play, whether you're doing that on the supply side or the demand side. But really with the genesis for licensing our tech and working more closely with these providers has come from conversations over the last year and a half, or some of our initial products that we brought to market. When you look at point solutions in the healthcare space, most of them are distributed on the product side. They're distributed on the health plan side. So you're aligning with TPAs, you're aligning with brokers, you're working directly with employers. And certainly we do a lot of that here at Savvos as well. But over the last year, there's been a number of markets where we have, just like what we've talked about, these physician-owned hospitals or ambulatory surgical centers. And they're all coming to us and saying, guys, we absolutely love what you're doing. Send us more business. We would stop doing everything else and just do direct pay relationships. And initially our response was, well, we're trying, but right now, we don't have a lot of membership on Savvos in Indiana or in Detroit, right? And then it dawned on us, why are we waiting for a point solution on the product side? Why don't we just give the tools and the technology to these providers and let's help them go build these direct pay relationships with these employers and their brokers in their local markets? Because what's interesting, Dutch, is they all know who they are. We'll talk to them and rattling off 20 employers. Man, if I could work directly with them. The challenge is, but like you said, they've all tried it and it didn't work. And I think there's a couple of reasons why it didn't work. Number one is they tried to build some unique concepts on an outdated model, right? So they were trying to do direct contracting on a claims adjudication rail, right? And it was like, why are we doing that? Like you took this great idea, then you implemented it in the most dysfunctional way possible. And of course, what happened? The thing just crumbled and it didn't work, right? Yeah. So I think that's one of the issues. But number two, if they are going to replace that claims processing business model, they didn't have an alternative until Savvos. Now we can go in there and show them, look, like we'll go in together, we'll plug into that employer's health plan, we'll make sure from a compliance standpoint, the plan documents have been amended, the right incentives and outreach. The other challenge you have when providers look to build direct pay relationships, they'll go plug in 10,000 members, and then over the next 2 years, they'll get 3 cases.
We see that every day. Yes.
Yeah, that's the problem because it's the number one, they don't have the right payment rails in place. But number two, you've got to have the right outreach. You've got to build the right incentives into your plan. And you just can't talk about it. I mean, you have to amend the plan document. Everything's got to be compliant. It's got to be approved by stop loss. And this is where Savvos comes in. We not only bring the technology that can bring providers and these employer groups together, but we bring the know-how and a great team that supports and backs up our tech to make sure that like we can build a plug-and-play solution. So now not only when we do process, a torn meniscus repair or, a total hip replacement or whatever that procedure might be, the transaction is simple. The payments come directly from the health plan in terms of reporting and, accumulators for stop loss and your aggregate policy and what have you. All that Savvos makes seamless in concert with their TPA, right? But in addition to that, we're talking about using the tech to handle effective outreach, regular education, great incentives within the health plan, and we get engagement. When we build these direct relationships, when you look at any health plan population, usually you're looking at about 20 to 30% utilization in any given year within that group. And we're capturing like 10 to 15% utilization. So that's well over half of the expected claims are running through the Savvos portal. So when we can build these kind of direct bridge relationships, we deliver, and these providers get a lot of that business steered to them.
So one conversation that I've had with physician groups specifically is, hey, Dutch, one of the things that we can do if you help us or if Savvos helps us is we can introduce you to the employer, right? And has that been helpful to you? Because whenever I go into a community, like I was in Salt Lake last week, as you know, because I saw you, and whether I was in St. Louis the week before, Kansas City, Tennessee, wherever we're going, the doctors are saying, hey, come to my event with me, right? Come have dinner with me and I'll introduce you to 4 employers that are self-funded. Are you kind of working through that process and encouraging the physicians to do that? Because I think they know everyone. They have all the trust in the community. And it seems like if they deployed your solution, they could win their communities at scale, right? They know them. They're trustworthy. Hey, sir, I already take care of all your patients. All your orthopedics, all your MSK already goes through me. What I want to do is instead of you paying XYZ company, you're just going to pay us directly. And so what I'm hearing from you is Savvos just kind of facilitates that process. Like, hey, we'll just do the back end. We'll do the payment rails. We'll change the plan. We'll do all the compliance work. Like, we'll fix this problem for you and set it up so that between now and forever, you can contract directly with employers.
Well, boy, you couldn't have said it better. Like, you're absolutely right. Like, for us, it's point solutions on the supply side, right? So we're doing that at hospitals, surgery centers. But to your point, we're building great relationships with advanced primary care and other physician groups because it's really exciting, right? In fact, they're already getting into these groups and taking care of their employees. And the reality is they're handling about 90% of the interaction. But in terms of, phenomenal primary care solutions, they're doing amazing work, but they're only impacting about 10% of the spend within the plan. So you're right. We're going to these physicians, we're going to these physician groups, advanced primary care. We're saying, look, why don't you do something similar? Why don't you align with Savvos and these groups that you're working with? Not only can we help you get into more groups so we can go support them together, but now we can plug you into, make you their navigator for specialty care beyond, your services. And let's put you at the center of driving not only affordability within the health plan, but let's put you at the center of driving enhanced benefits for these employees. So now you're taking care of not only 90% of the interaction with this population, but now you're impacting as high as 70 to 80% of the spend because now you're the navigator, making sure employees are taking advantage of these direct pay relationships. And these providers, Dutch, they're desperate for a better transaction. When I've talked about a lot of cost containment tools are built around putting the poor provider on the sacrificial altar, right? Like you look at what's happening with these surgeons and physicians today, when you look at some of their existing contracts or some of their network pricing, like for example, in Texas, we had I think it was a total knee replacement or whatever it was, something similar. It was an orthopedic case. And as the physician reached out because the member is going to run that procedure through their traditional network versus scheduling it through Savvos. And he said, guys, if I do this surgery with the network, I get paid around $950. And we looked at him and we said, you could charge $3,000, $4,000, $5,000 through Savvos.
Yeah.
And because the reality is that the crisis in healthcare, it's a crisis in geography, right? It has nothing to do with the surgeon. It's where these procedures are happening. And so if we can help members connect with affordable facilities, we can bring so much savings to the plan that we can afford to pay these surgeons what they're worth. So I see these surgeons today, they're doing cases for, torn meniscus cases for $550. They're doing total joints for around $1,000. To me, it's obscene the kind of prices that they're getting paid. When we can go into these plans, these physicians can get paid $2,000, $3,000, $4,000 per case, and we're still bringing tremendous savings to that employer group. And so it's win-win.
That is such a huge thing that you just said. It's the facility fees that are taking all the money from the plan and the plan member. And the physicians, the nurses, the nurse practitioners, PAs, they're getting very little of that money.
Yeah, that's our whole
And
point.
you're opening, please go ahead.
You've got facilities overcharging. You've got tremendous bloat in terms of like middlemen and admin and cost containment tools. I mean, you look at the revenue cycle management industry. I mean, the business of just helping providers collect their money over the next 10 years is projected to grow to almost a $500 billion industry. $500 billion
That's insane.
just to collect your money. So there's massive bloat in the middle, right? So when we bring these direct pay solutions to health plans and providers, for one, we eliminate all the inefficient billing and whatnot. When you build cash settlement at scale in a third-party payer environment, all the unnecessary charges go away because everything's just fully
Go away.
transparent. So
That's
you
right.
connect with providers, but the simplicity of the transaction, you're eliminating a team of 14 people on your billing staff. You're eliminating that RCM vendor that you're licensing. You're eliminating all this bloat. So these providers can plug into Savvos and say, yeah, I'll do that torn meniscus for $9,500. I mean, it was going to be $32,000 down the street. I'll do it for $10,000 because you're going to pay me as soon as care is delivered. And that's the value of Savvos. Our tech allows providers to get paid immediately. Our system sits between, and here's what's great about Savvos is we really sit as this buffer, this intermediary between providers and the craziness of how do I get my money from all these different players in the space. So whenever health plans and providers connect through Savvos, whenever care is scheduled, Savvos actually pulls the money from the health plan. We do it about a week before care is delivered. That's the way that as soon as care is delivered, that provider just goes into our tech. Usually they'll put in a few notes. Great surgery. We love this member. We had a wonderful experience. They'll hit the complete button and their money's there.
Imagine your revenue cycle management process, your collections process, and now you're not having to collect a copay, a deductible, potential co-insurance. You're out of that game. Now you're just getting all the money in your account in one day. Who doesn't love that? That's magic.
It's a fun transaction, right? And so the ability, so when you start to, like, for example, we might have a member in their health plan get into our platform and maybe every guy on the planet needs a hernia repair. We say, you think we're a hernia company. We do so many hernia repairs. But, you'll see a hernia repair drop into the system and they'll start engaging with a provider. And maybe we have a new provider in a new market like Florida. And every now and then we'll get a provider that gets in there and they'll build out a price. We'll say, we'll do that for our final price is $13,500. And then you'll see a lot of conversation. Well, that's great. However, we've got 4 other providers in that market that'll do it for about 5 or 6 or 7. So help us understand why you're twice. So for Savvos, it's not about being the cheapest price. It's about not paying the most, right? So we don't have to be the cheapest price. We just want to get into this range of affordability. We did a laminectomy case in Arizona about a year ago, and the provider that we had plugged into, they built out their price and they were at $32,000. And so our team and the health plan responded and we said, well, look, the member really wants to go there, but we've got 4 other solutions that are around $15,000 in your market. And that provider responded and said, oh, no, that was a contract we built for another health system. Let us put our cash pay price in. And it was 17. So it was a little bit higher than where our cheapest price was, but that didn't matter. I mean, all of a sudden we just dialed it in. We got a great price. So that's the idea behind Savvos is we create simplicity But as soon as that price is locked down within our platform, Savvos pulls the money from the health plan. It sits with us until care is delivered. And then as soon as care is delivered, we release the funds immediately. So there's no complex billing. You don't have to build 837 file feeds. I mean, you look at some of these states like the state of Utah, all these claims got to run through the UHIN network. It's insane the steps that these health plans go through to try to pay something. It's insane the steps that these providers go through to try to collect their money. And the whole idea behind Savvos is we're just going to create a modern, simple transaction. It cuts out all the bloat. It cuts out all the inefficiencies. And at the end of the day, it's a wonderful healthcare experience. But on top of that, we're bringing massive savings in a lot of these markets to these health plans.
I love it. I can't love it enough. I'm looking forward to the next conversation we have. Listen, that's a wrap on this special episode of the Rojas Report with one of my favorite entrepreneurs, Lucien Morin, founder of Savvos Health. And I always say Savvy Savvos because you got me saying it. Now, you've just heard from a builder who isn't waiting for permission. He's like the great builders. He's engineering a new marketplace where physicians lead, patients choose, and employers stop getting ripped off. Look, this company's not a theory. They're executing every single day. If you're an independent physician, you're an employer tired of bloated networks, or an investor looking for the infrastructure play in healthcare, I'm telling you, you got to look these guys up. I'll be tracking them, and this will not be the last time you hear from Lucien. In fact, I think we're going to do something in about 2 weeks. We're going to get him. We're going to maybe get a couple more people from his staff on, and we're going to hear about the patient journey. Look, if you loved it, share it. If you hate it, share this conversation anyway. Someone's going to benefit. Appreciate your time. Thank you, Lucien.